Friends, very good morning to everyone. Today's subject of discussion is about impurities. We are going to discuss about what is it? What is an impurity? What are its types? What are the sources of these impurities? What is impurity now? Impurities are the unwanted chemicals. In other words, these are the chemicals which is not required in the pharmaceutical product that remains with the active pharmaceutical ingredient. It can get developed in the formulation process, or they can get developed during the aging of both the active pharmaceutical ingredient and in the formulated form of APIs or medicines. In brief, they are unwanted chemicals that remains with the APIs or that develop during formulation or that develop upon aging of both APIs and the formulated APIs or medicines. These impurities can get developed during the process of manufacturing of either APIs or during the formulation process or upon aging. As per as ICH guidelines, International Conference of Harmonization, it defines the impurity as any component of a new drug substance that is not the chemical entity defined as the new drug substance. Any drug substance what we use is a chemical entity, is a chemical. If I take aspirin, aspirin has some chemical structure that is nothing but acetyl salicylic acid. Anything other than acetyl salicylic acid present along with this acid aspirin is a impurity. Hope now you can understand. Anything other than the active pharmaceutical ingredient present along with it is a impurity. Why we are dealing with impurities today? Impurities are the unwanted chemicals which are present with the drug substance which we use as a medicine. Even if it is present in the very small or minute quantities or amounts, it drastically influences the effectiveness of the drug. It may decrease the activity. Even if it decreases the activity, it is okay, but it may give unwanted adverse effects. That is most dangerous. Hence, the small impurities present in the active drug substance or active pharmaceutical ingredient will not only affect the effectiveness of the drug, but also it can influence the safety of the drug because the small quantities which is present can give adverse reactions. Hence, it is not the how much pure is our medicine is. It is about what is the effect of impurities present in it. Our drug may be 99.5% pure, which is responsible for activity. The 0.5% which is present as an impurity can give adverse effect or can decreases the efficiency of the drug very drastically. That's why we have to purify our drug molecules to 100%. Means, in other words, it should be completely devoid of impurities. It is something like we are 100% perfect or 99.5% perfect in all our work, but we are imperfect in 0.5%. That imperfection of 0.5%, what is present in us, will totally destroy the whole character of us. It is something like Ravan is a very strong and efficient person, but it is this small impurity in him has destroyed his whole life. This is the same with the case of the drug molecules too. How to avoid that? These impurities, what are present, can have unwanted pharmacological effect or unwanted toxicological effect. These are unwanted chemicals give unwanted pharmacological and toxicological effect. These effects seriously impact the quality of the drug and also the safety of the patient. Hence, in today's world, there is lot of interest in impurities present in the active pharmaceutical ingredient as it affects the quality and the patient safety. Thus, it is not only the purity profile which gains importance, it is also its impurity profile. Hence, as per regulatory norms of World Health Organization, not only do the purity profile, also does the impurity profile before introducing any new molecule into the market. International Conference on Harmonization, that is ICH, has formulated the guidelines which are workable so that we can control the impurities in our pure products. But before knowing how to control these impurities, we should know the types of impurities. And we should know what are the other synonyms used for impurities. The product, when we prepare, there may be other products obtained along with the product. And these byproducts can act as an impurity. That's why a synonym for impurity is a byproduct. The product which is formed upon storage, it may get degraded, and that is also an impurity. That's why degradation product is an impurity. The molecule which have prepared the product can interact with the byproduct and give another new product. That is the product which has obtained because of the interaction of the product and the byproduct. That is also an impurity. During the process of manufacturing, we convert A to B, B to C. C is the product, A is the starting material, B is the intermediate. The B can combine with, maybe combined with C if it is not purified. That is an intermediate product, can be an impurity. related products. In the final product, if you are not able to purify properly, other related drug substance present along with that can also act as an impurity. The product what we prepare can be transferred into new product by atmospheric contamination or upon storage because of decomposition, and that is transfer product, that is also an impurity. Penultimate product, as I have given example, A to B is which is an intermediate, B to C. The B, if it is not purified properly, it can coexist with C. That is the penultimate product. Final product, before that product, what is the intermediate present? That is penultimate product, which can act as an impurity. That's why these are other names which are used for impurity. Let us look into the types of impurities what we come across in pharmaceutical products. The first type is organic impurities. As the name indicates, they are of organic nature. They may be organic molecules. The organic impurities includes the starting material. If the starting material is not completely converted to the product, starting material also remains in the product. That can act as an impurity. The byproducts formed during the process of preparation of the product, that can act as an impurity. The intermediates which are not completely converted into product can be also a type of impurity. When the product is stored under improper conditions, it may get degraded, and that is also an impurity. Reagents, ligands, catalyst, what we used in the process of manufacturing of the compound of the pharmaceutical ingredient can be an impurity. If these impurities are for inorganic nature, they are called as inorganic impurities. The reagents, ligands, catalyst used, heavy metals used in the process of manufacturing, which can remain as residues. And you may take an example of the Maggie product, which was been banned because of the presence of lead. When it is manufactured, the metallic components used in the manufacture has the heavy metals as an impurity that got imbibed into the final product of Maggie. That's why the manufacturing process what we use can introduce inorganic impurities. The inorganic salts we use, the charcoal which we use for purification to remove the coloring material, the filter aids which we use for filtration purpose, all these types of things can be of inorganic nature, and that comes under the category of inorganic impurities. Another one is residual solvents. We use the solvents for the manufacturing of products and in the process of formulation, and the solvents can remain as residues. If it is not completely removed, then that is another type of impurities. There are three types of solvents which you use: class 1, class 2 and class 3. The class 1 solvents are the solvents which should be avoided completely. Class 2 solvents can be used in the limited amount. Class 3 solvents are those which are having very low toxicity and that can be used. The class 1 are highly toxic. That's why it should be completely avoided. The class 2 are moderately toxic. That's why it should be limited. These organic impurities, inorganic impurities, and residual solvents are the three types of impurities that are present in our pharmaceutical ingredients. What are the sources of impurities? The raw materials which we used in the manufacturing process of the products, that is raw materials may be a starting material. The starting material, if it is not completely converted into the product that coexist with the product, can be an impurity. The intermediate products, if it is not completely converted into product, can be an impurity. The reagents or solvents what we use in the manufacturing process. In total, raw materials, reagents, solvents, intermediate products used in the manufacturing process are the sources of impurity. The physical process and the chemical process which we used in the manufacturing of the active pharmaceutical ingredient can also introduce impurities, and that's why they can also be the sources, another second set of sources of impurity. The manufacturing defects and the manufacturing hazards is another set of sources of impurities. Another main source of impurity is atmospheric contamination during the manufacturing process. And after the preparation of the active pharmaceutical ingredient, and when it is storaged conditions, if it is not proper, it is in inadequate conditions, then this may degrade the product or decompose the product, and that remains along with the product, and it can be a source of impurity. These are all the impurities which occurs during the process of manufacturing. But there are some instances where it by chance or accidentally it gets substituted, or to increase the profit we adulterate the product with spurious or useless material, and these are also the sources of impurity. And how to avoid this? Completely impurities cannot be removed. 100% purity cannot be achieved. That is ideal conditions. But ideal condition can never exist. Like we are 100% perfect in all our things, it is impossible. And our process is how to reduce our bad qualities, that are impurities. How to control these impurities. If not, it can be completely removed, at least it can be kept under control. When you keep it under control, though the impurities are present, it may not have the serious or spurious effects on the body. And how to control these impurities will be the subject of discussion in the coming presentation. Till then, have a nice day. Thank you.